Hello, welcome everyone to this webinar that I'm presenting or hosting regarding the topic of triple negative breast cancer and how integrative therapies and alternative therapies can play a role in helping patients fight this disease. I'd like to first tell you a little bit about myself. My name is Dr. Walter Kim. I'm an MD. I'm an integrative oncologist. I've been working in this field for about 20 years. The word integrative basically means we are open to using multiple modalities in both the conventional and alternative or more holistic ways in trying to help patients. We are not necessarily against Western medicine, and we do find a time and place where it can be useful. We're learning every day as time goes on, as we find out more information. We learn and we evolve, and we tend to find better ways to treat cancers in general. So first I'd like to talk to you about the phrase or the sort of the buzzword triple negative cancer. It's something, because breast cancer is so common, whenever somebody is diagnosed, they may hear the word triple negative cancer, breast cancer. And in the conventional setting, that is a very important phrase. When somebody is diagnosed with breast cancer, basically once a breast cancer's diagnosis is confirmed, probably one of the three most important tests in oncology includes the triple stain. Whenever somebody has a biopsy or surgical tumor removed, they automatically run 3 stains on the tumor, the estrogen receptor, progesterone receptor, and the HER2 receptor. These are receptors that have been discovered relatively a while back. And in the earlier years of conventional oncology, and what they have found is that quite a few breast cancers, a good majority of breast cancers, anywhere between 40 to 60% of them, will overexpress abnormally these estrogen receptors, progesterone or HER2 receptors, and that can play a major role in one, offering or opening up treatment options for patients, and another, providing somewhat of a prognosis. So I know that at some point, before they discovered and routinely tested for the HER2 receptor or even the ER receptor, there must have been a time when people were just diagnosed with breast cancer and they didn't use the word single positive, double positive, or triple positive, or one positive, double negative, etc. So at one point they probably tested for the ER, in which case if you're positive, you're single positive. And if you're negative, you'd be considered single negative. Then they added the progesterone, which honestly I don't really think plays too much of a role, because 1.6% of breast cancers that are PR positive are ER positive. So if you're not ER positive, you have a 1.6% chance of being PR positive, according to the latest mega studies. And there really isn't a particular treatment per se directed at the progesterone receptor itself. It just goes along the lines of the focus on the estrogen receptor. The HER2 was discovered later, years that as time has gone by, the researchers have found that the HER2 receptor is a very unique receptor that is not only seen in breast cancer, but now in a multitude of cancers. So they then tested that routinely, and since there's 3 tests, they will tell you if you're triple positive or triple negative. So these are receptors for which there are treatments that block or work against what the cancer utilizes in order to grow. And in this case, specifically speaking, the estrogen receptor will bind to estrogens, and in essence, the estrogen will stimulate the cancers to grow, sometimes very aggressively, including the HER2 hormone, which is also known as the epidermal growth factor type 2. It's just another term they use, but it's a growth factor that is just known to stimulate growth in many cancers, including breast cancers, that overexpress these receptors. They are not the cause of cancers, but they are signals or hormones that cancers utilize in order to thrive. I'm going to kind of generalize this idea in the sense that cancer is an entity, a phenomenon, they don't quite know exactly what it is and how it's caused, but I think it's related to stress and an impaired immune system. But what happens is cancer, in essence, is like a baby, a fetus. When a woman becomes pregnant and those two cells form to form an embryo, the cells start dividing rapidly, and the baby or the fetus or whatnot, it literally grows at an exponential rate, and it starts taking control over the mom's body. And the mom has really no say in what the baby is doing to her body. Cancer is similar in that cancer can cause changes once present in our body to basically get what it needs to thrive and to grow, yet stay protected and alive by somehow evading the mom's immune system or from the mom's body rejecting it. So cancer, it varies. They manipulate our DNA. It's almost like they, in a way, they just juggle our genes that we have and cause mutations in them to get what it wants. One of the challenges with cancers is that it varies as to what mutations or changes they make, even within a diagnosis. So that's why in breast cancers, there are some cancers that are extremely estrogen sensitive or HER2 sensitive, and some that are not. Well, how do you know? You do the testing. So there's variability even within one diagnosis. And and why some people have ER or HER2 positive tumors versus the opposite, it's unknown. Cancer can pretty much do what it wants to do. And that's where, as treating physicians and as a way to help fight cancer, the more information we have about what cancer is doing to our body and how it's what it's utilizing and how it's what it's requiring in order for it to grow, is going to help eventually fight the disease and eradicate it. So there are patients who will be diagnosed with triple negative cancer, and in essence, people are, when they hear the word triple negative, they think, oh, it's such an aggressive cancer. People don't usually do well. These statistical response rates with conventional treatments are not very good at all. I would say that is likely true in the conventional world according to statistics using conventional protocols. But I would also say that I really do believe ER triple positive cancers are actually a whole lot more aggressive than triple negative cancers when you do not target those pathways that stimulate cancers to grow. So if you have a person that who is triple positive and you don't do anything to block the estrogens or the HER2 hormones, it's basically going to feed off these hormones and grow out of control. On the other hand, when a person is diagnosed and they do have the testing and they have the options of, let's say, targeting the estrogen pathway or the HER2 pathway, yes, they may respond extremely well. And that's where these patients tend to do better than those patients who are triple negative, because they don't have those options. So, as I said, these are what I call targets, or basically either hormones, proteins, peptides, enzymes, hormones, DNA modulators like oncogenes or suppressor genes, things that cancer can use to help it thrive. And what we're finding out in medicine is that the ER, PR, HER2 are just 3 of, I would say, at least 40 other types of targets for which they can test the tumors for, and for which there are treatments that specifically fight those, or they address those signals. And those signals are, can work independently, or they can work in conjunction with other targets. So as time goes on, we're finding that cancer can feed off of more things. So as I said earlier, in the old days, you could be single positive because they didn't have the HER2 receptor. Now there are at least 5 different FDA-approved other targets for which that can be tested for breast cancers and other cancers for which there are treatments available for, such as the PIK3CA, the CDK4, the mTOR, the PARP, or BRCA, or homologous repair deficiency or repair proteins or genes, for which there are other targeted therapies. So these are other options that are available to breast cancer patients, and they can be used to treat these patients. So what is misleading is that they focus on the 3 receptors, but there are many, many other targets that are present. And if they actually tested for those routinely, you could actually, upon initial diagnosis, say a person is going beyond triple, they could be quintuple negative, or they can be octuple negative or octuple positive, or a combination of positive and negative. How about even duodecuple, which is 12 targets that can be tested for. And so just because the ERP or HER2 have just been so studied and researched for and known in the scientific and medical community for so long, those are the targets that are really highlighted. But the reality is there are many other targets. So what I like to tell patients is that you shouldn't be branded as, having a bad prognosis because you have triple negative cancers diagnosis. It just means you have a tumor that just does not feed on these 3 particular pathways. So in the integrative field that we work in, we want to look for these other targets and use, if found, we can consider targeting them. I just want to thank everyone for joining this meeting. I know we have a lot of people who have posed a lot of questions, a lot of interesting questions, and we have a lot of patients who have been diagnosed with triple negative breast cancers and have been through the whole world of oncology, which, as a surviving cancer patient myself 4 years ago, I would say is an experience that I don't think anyone could really know until you actually have it yourself. So and there I see a lot of patients. They report that they have been treated, they've been diagnosed, treated, and are considered in remission. And I congratulate you, because that gives hope to other people that it's not that phrase triple negative does not mean you don't have a chance. There is hope, and people do get better and do survive. I wanted to address several people's questions. Some of these posts, such as one from Julie. Julie from Urbandale, Iowa. I think her last name is Henderson, or anyways, Julie from Urbandale, Iowa. Mel Rogers from Arena, North South Wales, I believe that's what it stands for, NSW. Deb Dorsey from St. Rete, Florida. And Lisa Shaplich from Rock Springs, Georgia. It seems as though your questions are very similar in that you mentioned that you are focused on or have a question on how to prevent a recurrence of triple negative breast cancer. When I see that, I assume you have been diagnosed, treated, and are in remission. So yes, one very challenging aspect of cancer is sometimes this is something I see just is extremely common. People are diagnosed, they're treated, they're thought to be in remission, and they're truly not. Either because they think they're in remission, but there's no evidence of disease. There's this theory that some cancer cells can be hidden, they can be stem cells that just hide out, and then over years they just appear, grow, and it comes back, and when they're diagnosed later, a few years later, they say it's a recurrence. Yes, it is a recurrence, but a lot of times I feel they're not really recurrences, it's just disease that's hidden, occult, that just somehow has been reactivated, and in some cases just not monitored. And people may assume they're free of disease, but they may not be, and they do not know that this cancer is still hidden and growing, and eventually will manifest itself. Because this is so common, I do believe one of the most important things is to get follow-up, and that I think would include simple things such as monitoring how you feel. So if you're starting to lose weight unintentionally, or if you're starting having abdominal pain or bone pain, or let's say palpable lymph nodes that just won't go away, skin changes, any symptom or finding that either persists or worsens that just seems unusual, it should be evaluated. Secondly, yes, go to your doctor. They can do physical exams, and if they happen to palpate a lesion in the breast or a lymph node that can be meaningful, they can then do a workup to make sure that the person is safe, and that if unfortunately they find a tumor, then the good news is they found it, and probably earlier than it could have been found and treated. Treating disease earlier rather than later is usually it makes sense. I would say is much better than treating at a later stage. Another way to test is to monitor through lab work. There are indirect and direct markers that could suggest recurrence of disease, such as tumor markers, or indirect ways such as looking at liver enzymes. Let's say a person's or bone, their liver enzymes in the blood shows a rise. Well, that's not normal. That may raise a flag and warrant a workup to see what's causing that. Or if you have rising bone enzymes without any reason to, without a a reasonable explanation, such as an injury or trauma, to explain that, and this can be followed and eventually lead to a workup, and then imaging, such as a PET scan, an MRI, an ultrasound, a chest X-ray, etc. So that's the first way, not to prevent a recurrence, but to detect it, to make sure that, or to be more certain that there isn't a recurrence. Now, as far as preventing a recurrence, a true recurrence, which means it coming back from scratch, a brand new tumor, just developing again. Well, I would say the best way to treat that is the same way you would try to prevent cancer from occurring in the first place. So this is where cancer is becoming an epidemic. It seems like everyone's getting cancer, and there can be a lot of explanations, such as just overpopulation, people are living longer. Now we have better ways to detect things, whereas before in the past, many people had cancer, but they never knew of it because they never got tested or whatnot. So the mystery is why. Why is cancer becoming so prevalent, and it seems to be affecting so many people? I don't think anyone knows exactly why. I do think if somebody did know, or if it was known, there would be a cure. But my opinion is that the development of cancer is related to stress, and that can be from any shape, any type of stress, whether it's emotional, environmental, lifestyle, even political. I think really political stress should be considered a major risk factor for heart disease. Just seeing what I see in the news nowadays, and how people are just so, in some cases, overcharged with political energy. So it can be related to hormone replacement, it can be related to infections, having COVID, infections that just can wear your immune system down. It's just known that stress, chronic and or acute, on chronic and acute, especially in the type of world we live in these days, it is just known that stress can suppress your immune system. And as far as we know, our immune systems that we're born with have the innate ability to easily recognize and eradicate cancers. So I think by definition, if you have a cancer, that basically means cancer is a dysfunction of the immune system. So I think the cure and the best way ultimately to prevent either a cancer from for the first time or recurrence is to get your immune system as strong as possible, to get it functional so that it can do its own job, do what it's supposed to do what it can do, and that is recognize and eradicate cancer. It's a little easier said than done. We've got to minimize negative stressors as best as we can. And sometimes it can be very simple. Some people just don't sleep well. They have irregular sleeping patterns. Their sleep is interrupted. Or they have schedules where they're flying in and out and have altered circadian rhythms. That's definitely not good for your health. I think there are a lot of ways to help your immune system, but something like sleep is just one example. I really believe a person's immune system can't function the way it's supposed to and well unless you sleep well. And I see a lot of patients who have never slept well and they still don't sleep well. So we work on preventing or reducing these negative stressors as best as we can. Also, we can use medicines. both natural and conventional. But when a person's in remission, I usually don't recommend more conventional type therapies such as chemotherapies, possibly a hormone, mainly supportive therapies such as if you're diabetic, take your diabetic medications. If you have high blood pressure, take your blood pressure medications, because if those aren't controlled, that adds stress to the body. But also natural therapies, which can include dietary therapies. There's a wide array of different dietary protocols that have been studied and practiced and have helped a lot of people. There now are a almost seemingly endless amount of supplements that are out there, which I believe are all helpful, but the problem is you can't take them all. So that's where working with a doctor to identify if there are certain areas of your health that are that need improvement, they can tailor their recommendations with specific supplements. There are repurposed medications like ivermectin, fenbendazole, low-dose naltrexone, metformin. These are basically pharmaceuticals that are not approved for cancers, but can be used to help either fight or prevent cancers. And they can also be used. There are now ways to put nutraceuticals, more holistic or natural type of therapies, and prepared in intravenous infusions. Giving anything IV is going to be more potent, and in many cases, sometimes they can only be given IV because one can only take so much of these nutraceuticals orally, such as vitamin C. If you take more than 2 grams of vitamin C a day, roughly, most people get a lot of diarrhea and very nauseated and whatnot. So if somebody can get, let's say, 50 grams of vitamin C intravenously, which is one of probably the most studied intravenous or alternative type of IV infusion that has been known to help a variety of ailments, including fight cancer, then I think people should consider that. It's just known that it's just human nature. When people are not feeling well, they know they're not doing well, they're going to be more aggressive. So that's another thing. Another way to prevent recurrence is to be very proactive. In other words, always focus on your health as being one of the top priorities. Like I said, it's human nature. When you feel good, you feel like everything's going to be okay, there's nothing to worry about, your focus can be maybe deterred or swayed towards other areas of life, such as finances or work or school or whatnot, which are important, but really our top priority should be our health, not only physically but mentally, because I do believe the mind and the body they do work together, and even and the mind, I believe, is such that it has capabilities that we're not even aware of, and has the potential. But I think it has the potential to even cure cancer. That's where I do believe our mindset and our emotions and our thoughts can play a major role in affecting our health, our immune system, and even affecting treatment outcomes. So the other ways of preventing recurrence of cancers is through researching, follow-up, and researching, finding as much information as you can, not only about your health, your whole health, because cancer is really just a manifestation of something else going on. So really just analyzing, studying, investigating all aspects of your health and working on being healthy overall, I think is your best way. I know some of these things are kind of generalized and easier said than done, but really I think that's what it comes down to. I wanted to address another question posed by Casey Hook from Minneapolis, Minnesota. She had asked, this person had asked, if there are any unique ways that I personally would treat or how I would approach or treat a triple negative breast cancer patient, as opposed to just the typical standard of care protocol or even other doctors' protocols. So I will say that there is a growing interest. It's a booming area of medicine and science involving oncology or the world of cancer that I think is, as we speak, transforming the way medicine is practiced. And that is by the use of technology and information. So as I mentioned earlier, there are tests that can be done that can characterize cancers. And at this time and age, every day they're finding new ways to find out more and more about how cancer, more about the characteristics of cancer, what it feeds on, how it survives, how it replicates, and what treatments may be effective. And that's where information, I think, can be golden. Information can be the answer. And as I said earlier, not every cancer is the same. So I think this one-size-fits-all, more old school type of treatment protocols may work for some people, but unfortunately, if you treat everyone with the same protocol, because of the variety of cancers and how they mutate and how they just differ for whatever reason, using new approaches of evaluating and studying a individual's cancer can be, I think, can really increase the likelihood of seeing success. So now they have what are called, they have ways to analyze tumor DNA, where they, using special technology, analyze the DNA to see if there are any mutations that cancers are known and can create that can involve or basically change our body or the cells to utilize anything and whatever it can to help it survive. And by finding out more and more about what cancer needs to drive it, the more we have to fight it. So I really am big on more precision-based medicine. I also am a believer in, as I said, treating your whole body. I do believe that ultimately, even though a lot of these conventional type treatments, whether the pharmaceuticals or repurposed meds, they can help shrink and reduce and attack cancers even significantly. And this can include even things like surgery or radiation. The idea is great. We want to see improvement, but the way it is with cancer is if you do not get rid of all the cancer cells, including this notion of a cancer stem cell, it's going to come back, because cancers, it's a phenomenon. I don't even know if it's, I don't know where it, if it's considered a pathogen, or maybe an alien, or I don't know. It's an entity that in a way behaves similarly to any living process. They adapt. They want to survive. And they learn, and it's survival of the fittest. So what we want to do is we want to always find out more information to see what the next steps can be, to see how we can further improve a person's chance against beating this, and also to not only see improvement, but to eradicate it. And that's where I believe using an integrative approach, as I said earlier, we can use repurposed medications, energy type therapies, dietary treatments, meditation, supplements, such as, one of my favorites are hot water extract mushrooms, where they can use special ways of extracting what are known as beta-glucans or polysaccharides, which have been studied extensively for decades and have been proven to help boost the immune system in a good way. Because I say that because the immune system actually is a double-edged sword in cancer. It's just been proven that inflammation is really parts of the immune system being overactive, and cancer, as I said, will do anything it can to help it survive, and it's just known for a fact that cancer utilizes parts of our immune system to survive. So activating the immune system is not always just the answer. It's really getting the immune system that has the ability to fight cancer to work, and also suppress parts of the immune system that is known to help cancer grow. Supplements, there are a lot of supplements that are available that can help not only boost your immune system, but detox. And in this day and age, we are exposed to a lot of environmental toxins in foods, in our household products, in our industrial agents, and man-made products. I mean, we just don't even know. Heavy metal toxicities, etc. We want to detox our body, because toxins are known to put stress on our body, and therefore can suppress our immune system from doing its job. Another way to help the immune system is to fight chronic and pathogenic infections. I say pathogenic infections because we have things like a microbiome in our gut, where we have a lot of bacteria, and they're just known to help us. We don't want to get rid of those. So pathogenic infections are infections that are known to cause disease, and they can cause a whole variety of different symptoms, cause more serious morbidity, complications, and also there are certain infections or pathogens that are just proven. They have the ability to suppress our immune system. We want to get rid of these things. Spike proteins, they have to be toxic to our body. I mean, I just don't. The evidence shows that they can alter our immune function. They can cause unhealthy inflammation. So we want to fight chronic infections too. And that's where treating holistically or using the integrative approach can be very helpful. So that is essentially my unique way is to investigate, and tailor treatments to each individual's case, to try to utilize information to find the treatments that are going to work for a particular person, not another person, but for that person. Of course, there's no guarantee, but I think it's better than just throwing a blanket type approach across the board for every single type of cancer, assuming that they'll work for everyone, because everyone's health is different and everyone's cancer is different. And not only that, but their cancers can change. And also by treating the whole body, and as I said earlier, working on the immune system, detoxifying, decreasing negative stressors, and also fighting chronic or even acute infections. And I think I said this, detoxifying. The last area I want to touch on, or a question that I'd like to address, is from Michelle Grace from Woodburg, Virginia. She had asked, why is it that I think I started out in this webinar talking about this in a way. She had asked, well, why is triple negative cancer so hard to treat? Why is it so aggressive? And why are people so afraid of this diagnosis? Well, as I said earlier, it's conventional medicine has their ways of doing things, and they usually do things by protocols. And at this point, they have protocols that are used depending on a person's hormone status. And if they don't have targets, not only these 3 targets, but many, many other potential targets for which there are approved or even non-approved treatments, then they have less options for treatments. And so it just makes sense. You have less options, you have the chances of fighting the disease is harder. And that's where I think the future of treating not only cancers, but triple negative breast cancers is finding out if there are more options and not just limited to this triple target. I mean, there are, like I said, so many other ways they have found so many ways that cancers change our bodies and cause our DNA to mutate to get what it wants, and they adapt, and we just have to find out what it is that what they're doing, and how they mutate or how they change, and we adapt too. And it comes down to taking away cancer's ability to control. It wants to control, and a lot of times we cannot control what it does. It just takes over, just like I said, like a baby. So we need to get control, and meaning all of us, patients, healthcare providers, scientists. We need to be able to control cancer by understanding and learning more about how it operates and what it's vulnerable to, what it feeds on, how it thrives. So I think there is hope in that we are, as time moves forward, they are now, they have more sophisticated testing, and they're developing newer approaches and newer ways to treat that are different than the older paradigms, some of which have been around for literally 30 years. So the world of oncology is in this modern day and age is I think is evolving, is evolving, and some of it may be even promoted by AI. Information is extremely powerful. So anyways, I just wanted to say, for those of you who are dealing with triple negative breast cancers or any cancers, I do feel for you and want to say that there is hope. And my message to you is basically keep searching for doctors or ways to help your whole health, to minimize negative stressors, to get your immune system as strong as it can be, to get to basically let it do its own job, which is essentially it has the ability to eradicate cancer, and also find providers who are willing to work with you and have the means and ways and experience in researching and learning and finding out what is unique about your health and about your particular diagnosis, and find treatments that are going to work for you. The bottom line is, if you find the treatments that work for you, you're going to be fine. If you don't, it's not going to look good. And for those who are cancer survivors like me, as I said, follow-up is most important. I follow up a lot, and it's not fun all the time. And it's sometimes scary, doing PET scans and lab work and other types of testing. And so follow-up is so important. There are so many people who, like as I said earlier, they have a recurrence, and a lot of times they have a recurrence because they never even bothered to check to see if they may have residual disease, because they are either afraid or in denial, or they just assume that they're going to be fine. So you monitoring is very important. And treat holistically. I hope this has brought some inspiration and some key points or knowledge to those who are joining us, and I'm hoping that in the future I can provide some more sessions like this where I may be able to share my knowledge and experience to help those who are suffering from cancer. Thank you.